Welcome back, everyone. I love these segments. I'm going to just say one word, and those of you who know what word I'm talking about, you're going to just pay a little closer attention. Turkey neck. It's one of those things as women that as we age, we start paying closer attention to what's going on right through here. We have Dr. Henstrom here from Utah Facial Plastics. We're talking about things you can do, one procedure in particular, that will just get rid of the turkey neck.
That's right.
What's it called?
First of all, before I start, I'm going to take my phone out. No fubbing here today.
Thank you for not fubbing me.
Putting the phone down.
I've been getting fubbed all day. Thank you. Thank you for that.
We're talking about a procedure called a direct neck lift or a direct neck excision.
Okay.
And what it is specifically just excising the excess skin and loose skin and adipose tissue from the central portion of the neck to give us a better contour.
Okay, why does this even happen to begin with? And why, what's going on?
Well, you know, it happens for a number of reasons, but one is we age, we lose elasticity in our skin, meaning the skin doesn't recoil and rebound like it should, and it starts to sag and hang. And so that's one reason. Another reason might just be weight gain, and we gain weight in our neck and our face just like we do elsewhere in our body.
Yeah.
So when that happens, this area starts to hang down a little bit lower than we'd like, and so it's an option for us.
Okay, so we've been hearing a lot about a procedure called Kybella, which is something you guys offer. This is different.
This is different, yeah. Kybella is an injectable medication that you can use to help dissolve the fat underneath the chin.
Okay.
And this builds upon that. In fact, my partner, Dr. Scott Thompson, was here last time, and he was talking about Kybella.
Right.
He was talking about submental liposuction and other neck and facelift, traditional neck and facelift procedures that can be done. This takes it to a different area because what we're doing is we're directly excising the problem area. Then we're suturing the skin together in the midline.
So you're cutting it out.
We're cutting it out. In addition, those muscles that cause the band, here's a couple before and after pictures, and the muscles that form those bands on our neck, we can tighten those as well as we put after. And actually that after shot isn't the right picture as I look at. That's the right picture, the before and after.
There's
right
the
there.
after shot. Wow.
That's taking it, and this shows that it's really common, well, it's more common in guys, older gentlemen, who especially are still wearing button-up shirts or ties to work, and it's really obtrusive on them. It hurts, they don't like it, it hangs over. Oh
my gosh, that takes years off. I mean, we're talking 15 years.
Yeah.
Look at the difference.
Coupled with some weight loss on his own, and this procedure to get rid of some of the central turkey gobbler deformity makes a big difference.
I cannot believe that is the same human.
That is the same person.
That is unbelievable. Okay, so let's talk about the recovery process. What is that like?
Yeah, so after the surgery's done, we're going to wrap your neck and in a gauze wrap, and basically you're going to have that on. You're wearing that 24/7 for about a week until we take the sutures or the stitches out. Once those come out, you wear it at home at night when you're sleeping for a few more days. There's bruising and swelling involved. Individual results may take a little bit more time depending on the person, but usually after a couple weeks most of the bruising and swelling is gone and people are recovered. After the stitches are out, for females, if they want to cover it up with some makeup, they can do that.
Let me ask you this, where are you actually stitching? Like, where are you, can I ask that?
Yeah, absolutely.
I want to know, like, where you're cutting.
Yeah, and so where we're cutting is right underneath the chin, and then down the neck in a wide swath to get all of that tissue out, and then down in the lower neck.
So what about scarring?
So there's a central midline scar, but most of it's hidden under the chin. As you can see in those previous pictures, a lot of it comes down here, right to that cervical mental angle. So that's a lot of the scar. And then some of it continues down here. The length of this will vary depending on the person and how much they have that we're excising, but it hides very well.
What a perfect procedure for it.
It's a better look, especially for gentlemen who are wearing a collared shirt still. It covers it up, most of it up.
Is there a certain age range that you're working more with?
Most of these are patients that are older.
What does older mean? 50s,
50s,
60s?
60s, because that's when we start to lose the elasticity. So, for instance, older gentlemen with this heavy weight, or the other patient population this is pretty popular in are patients who have had gastric bypass surgery, and they've lost a lot of weight. But the skin is just hanging, and it's there, and they can't do anything about that, and so we need to remove that. And so instead of lifting laterally You know, this is an option for patients. It's less expensive, it's less downtime than a traditional face or neck lift. We can do it in the office under just a local anesthetic, so they don't have to go to the operating room to get a general anesthetic, and the recovery is quicker. So this is a great option for some of the gastric bypass patients who have this issue continuing.
Okay, if this is something that you're interested in, please go to their website, and we're going to have a link from our website as well. Thank you so much, Dr. Henstrom from Utah Facial Plastics.